So tell us, how did we do during this government created pandemic? What's our grade on an A to an F scale?
Oh, Shawn, this was an abject failure from a public health perspective for so many reasons. Let me just try to sort of illuminate a few of the
Mm.
issues. I'd say from the beginning, the role of public health, the mandate of public health, is to consider the impact of any particular problem and also any particular solution on the entire public. It's very different from when I enter a room in my office to see a patient, or when I'm in the emergency department and I go in and you come in as my patient. In those situations, it's a one on one interaction, and you are my sole interest, your best interest, and your outcome. Unfortunately, that is not how public health works. When I put my public health hat on, I not only am considering what's good for you, Shawn, but if this is a mass casualty or something infecting millions of people, thousands of people, whatever it is, I am obligated in public health to consider the impact on everyone, and not just their physical health, frankly, also their spiritual health, their psychological health, emotional health, financial health. So from the beginning, when the pandemic hit, the people at the helm of the response, I don't care if you're talking about the president or Anthony Fauci or people running, the governors, their role should have been to say, it is not about just COVID, the virus, and not a just, when I hear people say, if we can save just one life. No, no, that is not the role of public health, to save one life. It's to look at the entire public. So when they started doing things like suggesting a lockdown, something that we've known for decades is far more devastating, is far more economic, emotional, psychological devastation than it will ever help in stopping the spread of a respiratory virus. They were off the rails. When they started talking about implementing mask mandates, we've known for decades that masks do nothing appreciable to stop the spread of respiratory viruses, and in fact are very damaging in other ways, both emotionally, psychologically, and physically. They started making up constructs like social distancing. Absolutely made up construct. Makes no sense. They knew it. They've now, 3 years later, acknowledged it. But it wasn't simply a nuisance to do it. It was devastating. Small businesses were spending money they didn't have, putting up plexiglass shields and one-way stickers on the floor. And we taught little children to be afraid of others. They're on the playground screeching 6 feet distance. These were things that weren't just nonsensical. They were harmful. And then fast forward to the vaccine program, everyone has known from the beginning of time, vaccinology is very, very complex business. I've said for a long time, the human immune system is the last great frontier of medicine. The immune system doesn't always respond the way we think it will. So the idea that you would create and launch a, quote, vaccine in record time, in a matter of months, without any of the long-term studies for either efficacy or safety, was absolutely unconscionable. So when you put the entire thing together, the entire pandemic from a public health perspective was predicated on fear. They acted as if all of us were at equivalent risk when we knew from the beginning that was not the case. They employed concepts they implied that they were concepts in public health that absolutely we knew were flawed. You never, ever isolate the masses to protect the few. You isolate the few to protect the masses. Quarantining healthy people isn't a thing. That's called tyranny. There is no such thing as quarantining healthy people. So I could go on for the entire show talking about the failure of the public health response, but suffice to say, this will go down as truly the greatest travesty of public health, certainly in my lifetime and likely in history.